Greetings everyone. Want to highlight about a particular incident which we experienced. 5-year-old Rashmi was brought into our ER with complaints of pain in her left elbow, holding it close to her body and refusing to move it. The parent told me that the pain started suddenly while he was trying to cross the traffic, holding his daughter's hand and pulling onto her suddenly. This is a very common presentation of a condition called as a pulled elbow. It is known as nursemaid's elbow or a radial head subluxation. Our elbow joint is made up of the upper arm, called as the humerus, and two bones in the forearm, called as the radius and the ulna. The joint has two aspects: the humero-ulnar joint between the ulna and the humerus, which allows for bending and straightening of the elbow. The radiocapitellar joint between the radius and the humerus, supported by the annular ligament, which allows rotation of the forearm. Now, this is the joint which is involved typically in the pulled elbow. A pulled elbow occurs when there is a radial head subluxation caused by axial traction or a sudden pull of the extended rotated arm. It occurs most often in children aged 1 to 6 years of age, but can happen anytime from birth to age of about 8 years. It's more common in the females. The bones and the ligaments of a young child are often soft and still developing. This makes it easy to sustain such injuries. As the ligaments tighten as the child gets older, the incidence reduces. The injury was named at a time when nursemaids or nannies commonly cared for children and had the reputation of causing this injury by pulling on a child's outstretched arm. This is the most common cause of upper extremity immobility in preschool children and accounts for 2/3 of the upper extremity injury. The common causes for pulled elbow are pulling a child up by the hand, especially an outstretched hand, swinging a child by the hands, jerking a child with its arm, and less commonly, a child may roll over the arm in a crib or in the bed and may cause this injury. The diagnosis is made based on the history, the physical assessment, and the mode of the injury. The child will hold this arm against their body with slightly a bent position. Touching the arm without moving the elbow usually is not painful. An X-ray is done to rule out fractures. The treatment consists of manipulating the child's arm so that the annular ligament and the radial head return to their normal anatomical position. There have been various maneuvers which have been described to achieve the same. Though the process will take only a few seconds, the child may experience temporary pain during the reduction. Usually, immobilization with splinting is not required. It is important to understand that once a pulled elbow has occurred, there is a likelihood of recurrence. Recurrence rates have varied between 5 to 25%. For this reason, as well as to prevent an initial recurrence, there are certain precautionary measures which the parents are educated about. To safely lift a child, grasp gently under the arm in the armpit. Do not lift the child by holding the wrist or the hands. Do not swing a child by holding the hands or the forearm or the wrist. Avoid tugging and pulling on a child's hand or arm. Avoid lifting the child by pulling on a single arm. This is a routine orthopedic complaint which we handle frequently. For any further queries, please do reach out to us in Aster Hospital, Whitefield.